Hello, my name is Alfred Brockman with the Wayne Focus. So we're going to briefly go over what is fentanyl. Fentanyl is a very dangerous drug, and it's often either used directly or mixed with heroin or other drugs to increase their potency. It is a opioid. Let's learn all about it, and then you can find more information down at the bottom of this video from the National Institute of Drug Abuse. And what is fentanyl? Fentanyl is a powerful synthetic opioid analgesic that is similar to morphine, but it is 50 to 100 times more potent. It is a Schedule II prescription drug and is typically used to treat patients with severe pain or to manage pain after surgery. It is also sometimes used to treat patients with chronic pain who are physically tolerant to other opioids. In prescription form, fentanyl is known by names such as Actiq, A-C-T-I-Q, Duragesic, D-U-R-A-G-E-S-I-C, and Sublamaze, S-U-B-L-I-M-A-Z-E. Street names, that is, when it's sold on the black market, street names for fentanyl or fentanyl-laced heroin include Apache, China Girl, China White, Dance Fever, Friend, Goodfella, Jackpot, Murder 8, TNT, and Tango and Cash. Now, how do people use fentanyl? When prescribed by a physician, fentanyl is often administered via injection, a transdermal patch, or in lozenges. However, the fentanyl and fentanyl analogs associated with recent overdoses are produced in clandestine laboratories. This non-pharmaceutical fentanyl, that is not manufactured at a pharmaceutical manufacturing location, that is a business, this non-pharmaceutical fentanyl is sold in the following forms: as a powder, spiked on blotter paper, mixed with or substituted for heroin, which is very dangerous because it can kill you, or it's much more potent than heroin, can kill you sooner, or as tablets that mimic other less potent opioids. People can swallow, snort, or inject fentanyl, or they can put blotter paper in their mouths so that fentanyl is absorbed through the mucous membrane. How does fentanyl affect the brain? Well, like heroin, morphine, and other opioid drugs, fentanyl works by binding to the body's opioid receptors, which are found in the areas of the brain that control pain and emotions. When opioid drugs bind to these receptors, they can drive up dopamine levels in the brain's reward areas, producing a state of euphoria and relaxation. Fentanyl's effects resemble those of heroin and include euphoria, drowsiness, nausea, confusion, constipation, sedation, tolerance, addiction, respiratory depression and arrest, unconsciousness, coma, and death. Why is fentanyl dangerous? Opioid receptors are also found in the areas of the brain that control breathing rate. High doses of opioids, especially potent opioids such as fentanyl, can cause breathing to stop completely, which can lead to death. The high potency of fentanyl greatly increases risk of overdose, especially if a person who uses drugs is unaware that a powder or pill contains fentanyl. Fentanyl sold on the street can be mixed with heroin or cocaine, which markedly amplifies its potency and potential dangers. Medication naloxone is an opioid receptor antagonist that reverses opioid overdose and restores normal respiration for a time. Overdoses of fentanyl should be treated immediately with naloxone and may require higher doses to successfully reverse the overdose. And please keep in mind that the opioids may be they last longer in the bloodstream than this naloxone, which reverses it. So you could give somebody this stuff, give them 2 doses, they come out of it 30-40 minutes later, they're overdosing again, and they're potentially going to die. So getting them to an emergency room is very important to get them cared for, and then follow-up procedures to help them get away from the drug and be free from it. Now, let's go through points to remember, and then we're going to wrap this up. Points to remember are: fentanyl is a powerful synthetic opioid analgesic that is similar to morphine, but is 50 to 100 times more potent. Non-pharmaceutical fentanyl is sold in the following forms: as a powder, spiked on blotter paper, mixed with or substituted for heroin, or as tablets that mimic other less potent opioids. Fentanyl works by binding to the body's opioid receptors, which are found in the areas of the brain that control pain and emotions. Its effects include euphoria, drowsiness, nausea, confusion, constipation, sedation, tolerance, addiction, respiratory depression and arrest, unconsciousness, coma, and death. The high potency of fentanyl greatly increases risk of overdose, especially if a person who uses drugs is unaware that a powder or pill contains fentanyl. Thank you so much. You can learn more from the link down in the bottom. And be happy, be healthy. Stay away from drugs.